So what did the union find itself doing about all of this? I mean, what was the union able to address in all of this? The union must have been absolutely swamped. What do you recall about those days and the kind of thing the union was facing? The issues you were taking on, where you were spending your time?
The professional responsibility clause in the collective agreement became very important. It was one of the crucial ways we had of documenting the violations and shortfalls in patient care. I remember specifically one, and Jane probably will remember some too, that because of the regionalization of supplies, they didn't keep the same level of supplies at the hospitals. They had a sort of a centralization of where they were, whereas before we'd always had a fully stocked supply department with all the various things. And what that meant in this one case was a young fellow came out of surgery. He'd had his jaw wired. He was intubated when he came out, but during the course of becoming awake, he extubated himself. And what happened was the nurses couldn't find the tube size that they needed to get back into him, and they almost lost him because there wasn't a size in the hospital. The size had to come, I don't remember all the specifics, but in this particular case, it had to be brought by taxi cab. This was the way in which hospital supplies were transported from some other site to re-intubate him. And well, actually, I think they ended up cutting they cut the wires, and then he, I don't know in fact whether they had to intubate him again. But anyway, he had to go back to surgery and be rewired after that. That was just one example. But the PRC, because what was attached to that documentation process was then a meeting of management and the union. And we had through that process the factual evidence of how patient care was being compromised and what liability there was there for the system, the government, the hospital board. And we had some very heated meetings about those documentations. They went up, Jane may help me, but I think it was approximately a 400% increase in the submission of the forms during that mid-90 period. And what we worked very hard on was a process then of compiling, taking all the statistics from that. And speaking to your question of what did the union do, we've presented a brief to the Minister of Health in 1996, which was a compilation of the professional responsibility documentations that had occurred. And in that brief, we outlined the reality of what was happening, the effect it was having on patients, the compromise of nurses, nursing standards. And we made recommendations to him about how this could be changed or improved upon. And in my recollection of that meeting, it really formed one of the reasons why I decided to go into politics, because at the end of the meeting, we asked him, would he consider adopting our recommendations? And he said no. And we said, well, do you have then any recommendations that you would ask us to consider, or how would you address it? And he had no desire to engage or respond or even acknowledge the reality that we were facing. And I remember leaving the legislature that day being so angry, just so angry that the cavalier attitude and the callousness that the minister of that day, who I won't name for purposes of being somewhat kind, but they just didn't care, and they didn't want to hear about the reality. So, as I say, I decided that really was the force that made me say, well, if you won't listen to me as a registered nurse, then I'll run for office. So I'll stand with you in the House, and you'll be forced to listen to me there.